Gillette, we have a team of pediatric orthopedic surgeons. We feel that it's very important to understand the growing musculoskeletal system and also, and just as importantly, to understand children and the fact that their needs are different than adults.
Gillette started as a children's orthopedic hospital. That's helped us to be able to develop a focus and expertise in children's orthopedics. The orthopedists recognized that there were many other issues that were affecting the children that they were taking care of. So that then was the impetus for the hospital to broaden the care and bring in other subspecialists. One of the things that makes Gillette really different is that all of those subspecialists are here under one roof.
One of the things that makes Gillette Children's Specialty Healthcare a unique institution is the fact that we take care of a huge breadth and scope of pediatric problems. We take care of children who have acute injuries, fractures, infections, things of that nature. We obviously take care of children who have complex neuromuscular problems such as cerebral palsy, but we also take care of a large population of children who have problems such as clubfoot deformities, hip dislocations, developmental hip problems.
We see all kinds of spine problems here at Gillette. I would say the large majority of problems that we see involve scoliosis, which is essentially a curvature and rotation of the spine. Another common problem that I'll see is back pain. Back pain is increasingly prevalent in our pediatric populations. I'm privileged to be part of a large department of orthopedic surgeons, 12 orthopedic surgeons, which is one of the largest department of orthopedic surgeons in the United States. That allows me to focus entirely on a patient's spine and the care of that spine. And if I note another orthopedic concern that I have with that patient, I'm able to pick out one of my partners who is subspecialized in that field, such as hand or upper extremity or hip and lower extremity, and have the patient see them, and we can collaborate and come up with a treatment decision for that patient together.
You know, in addition to the expansive kind of medical services that are available at Gillette, we also have a group of individuals who work with us in our cast room and in our brace shop and our physical therapy department, who are especially trained and used to working with children. That is the entire nature of their practice.
The Gait Analysis Laboratory is a way to measure movement. The type of movement that we measure most of the time is walking.
There are a number of different components of emotion analysis. We use all of those components to help inform the decision making.
It's very rare that you work in a hospital environment where you see people from the level of child life specialists to nurses to physical therapy to the radiology technicians to the OR nurses and physicians be as committed and centralized in their goal of caring for the patient.